Welcome. I'm Dr. Anthony Goodman, and this course is Understanding the Human Body, an Introduction to Anatomy and Physiology. This is the first of 32 lectures in which we're going to study the anatomy and then the physiology of all the organ systems in the human body. We're also going to make correlations in the pathophysiology and the pathology, the abnormal structure and the abnormal function of systems of the human body. We're actually going to study this slightly differently from the way it's studied in medical school. Medical students dissect cadavers and they study regional anatomy. We're going to be looking at systems anatomy. The medical students need to know, for example, what organs and structures lie next to each other so that in the operating room they will know where they have to be very careful, where they can make some time, and what has to be protected. They can't really study systems in a human body when doing a dissection. We can do that here. We're going to look at each system one at a time, and then we're going to compare the physiology and the diseases that can happen to that physiology. Today we're going to look at the heart and the structures that are part of the physiology of the heart. The heart used to, for centuries, define death. If the heart was beating, you were alive, and if it was not, you were dead. That was the legal definition, and it was the physiologic definition. Today we define it by brain death rather than heart death because of the advent of organ transplantation. But still, without the heart, nothing else would be working. So we're going to begin here with the heart of the matter and talk about this wonderful pump that can pump 20 gallons a minute, an enormous volume, which weighs less than a pound, which can go on for 100 or more years and rests a fraction of a second on every beat. It's a tireless, energetic organ that can pump approximately 1.5 million gallons per year, year after year, and rarely has any malfunction until the time it's ready to give out and the patient dies. We need to study in the beginning the types of circulation in the body, and there are generally two types of circulation. If we look at the first slide, you'll see the heart in the center. And this is highly schematic. This does not reflect the way it is anatomically, but basically we have two systems going on. We have what's called the systemic circulation, meaning the blood that is going out of the heart and feeding all the organs of the body. This shows schematically the brain, and down in the rest of the body, which would include the organs of the chest, the abdomen, the extremities, the muscles. That's the systemic circulation. Blood returns to the heart through veins to be pumped out again. There's a secondary circulation. After the blood returns to the heart, it needs regenerating. It needs to get air from the lungs, oxygen, needs to get rid of waste gases, so it's pumped out to the lungs where it is oxygenated and then returned to the heart, and that's called the pulmonary circulation. And these are two parallel and separate circulations that have a different function and a very, very different anatomy. In general, when people think about the heart and the lungs and the circulation, they think about arteries carrying oxygenated blood, and they think about veins carrying blood without oxygen. And that's not really a good definition. We come back to the slide. In general, the systemic circulation, that holds true. Blood leaving the heart, going to the body, or going up to the brain and the upper extremities, does carry oxygen. So those vessels in the arteries are carrying oxygenated blood. But if you look at the pulmonary circulation, the vessels going out to the lungs, the pulmonary arteries, are carrying deoxygenated blood.